From the plains to the rolling hills, Oklahoma is a state that resonates with stories of resilience, determination, and pride. Welcome to Inside the 1581, a podcast of the Oklahoma Hospital Association. Together, we'll dive deep into the heartbeat of the great state of Oklahoma as we journey through the rich history, diverse culture, and the ever-evolving landscape within the 1,581 miles of border in our nation's 20th largest state. Each episode of Inside the 1581 will feature conversations with the many voices which help shape our state's future and our shared vision of improving health and healthcare in Oklahoma.
Welcome to this edition of Inside the 1581. I'm Rich Rasmussen, and I'm delighted to have joining me here today a couple of leaders really in their field, in their community, in focusing in on how we can do a much better job in the workforce space. And I've got James Sharp, who's the Director of Nursing for INTEGRIS Miami Hospital and INTEGRIS Grove. And joining him is Leslie Sexson, who is Grove High School counselor at Grove High School. And this is really exciting to have this conversation because we're going to talk about collaboratives. We're going to talk about cooperation, and we're going to talk about how we as very large employers in many of our communities, particularly in Grove, in Miami area, how you guys have worked with your high school to create a pipeline and opportunities for young people to find a career in healthcare. So before we get into this, let's just learn a little bit more about you, James, and you, Leslie, about your career, what you do, and how you guys came together in this partnership.
Sure. I'm the Director of Nursing for INTEGRIS Grove and Miami Hospitals. I've been with INTEGRIS for 15 years now. And
all the time up there up in the Northeast
in
corner?
the Northeast, yeah. That's right.
Beautiful country.
Raised in that area.
Country. Yeah.
And we have lots of trees. And,
you do. Great Lakes. Great Lakes.
Right.
Yeah.
Not much red dirt. And so our soil's black there. But it's a good time up in the Northeast. We have Grove sits on Grand Lake of the Cherokees. And so we have that great benefit in our community. I've been in healthcare for 20 years or over 20 years now, close to 25 years. And just most of that time has been spent in Oklahoma.
Very good. And your entire career in nursing was in the facility that you're working in today in Miami?
I spent 10 years in Joplin.
Okay.
At St. John's and then Mercy Hospital.
Very good.
Yeah.
Very good. So, Leslie, tell us about you.
Well, I'm a school counselor, and I'm almost afraid to tell you this, but I'm entering my 40th year in education.
Congratulations. That's awesome.
Thank you. Well, I love it. I absolutely love working with the students and, learning what they're about, and that's just what motivates me. Okay. And I am fortunate that I've actually worked in 3 school systems that are in Northeast Oklahoma during my career, which I was in Bartlesville and also then in Miami for a time, and then now I'm in Grove. I was sort of following my husband around as he was doing the second retirement kind of thing. So that's why we ended up in like 3 different areas. But I absolutely love Grove and love our partnership that we've developed. And we're starting to see such great benefits from it. And that's what it's all about. That's why we do this.
Well, and I think oftentimes we don't appreciate that hospitals are literally small communities. And you look at the opportunity for a school system, partnerships to be created with a hospital where not only do we employ our caregivers, right, our nurses and our physicians and our RTs, but we have people that work in culinary services. We have folks that work in environmental services. We have folks that work IT. We have folks that work in finance, folks that work in security. I mean, it is a micro of the entire larger city or county that you have. And so tell me how you guys came together in this partnership and how it works between the school and between the hospital.
Well, in our rural communities, this hospital and the school are lots of times the 2 biggest employers. And
incidentally, that's pretty much in every small town. I mean, if they have a hospital, they are probably the largest private employer in most communities.
And so we have a great opportunity to, to work together, to empower each other, to do great things. And Leslie and I met through the Northeast Workforce Development Board. They have a business sector partnership for healthcare. It's called the Healthcare Advisory Council. And Leslie, I think at the time, was at Bartlesville, and so was a counselor at Bartlesville. And she was talking about high school internship that she had started in Bartlesville, and we had a presentation about ICAP, which is career planning through high schools. They start at mid-school and start to do career planning, and that just really spurred my interest. I had two children that were starting their high school career, and I was starting to do career planning with them and just recognize the need for that and the lack of that in healthcare. And so that's really kind of how Leslie and I started talking about internship.
And so Leslie, you're working to identify these students, or are the students self-selecting, saying, "Hey, I'm interested in a career opportunity in healthcare"? How does that work? So, James has opened the door. So, how do you make sure that you are moving kids through that door?
Well, that's a great question because, first of all, I view high school as just bridging the gap to what's in a student's life after high school. And if you kind of take that philosophy on, then it is, yes, looking at your students and identifying what their talents they are. Every student has talents. And it is figuring out what that is. And I'll be honest, sometimes they don't even know it. Sure. And that's actually most of the time they don't know it. But there's certain characteristics, like if you want to go into healthcare, there's certain characteristics that are required, like being a city and everything that you mentioned, the jobs that are in healthcare, you almost always have to have that serving mind and want to be a helper. And you can have the talent of, being a surgeon, or you can have the talent of adding up numbers or communicating. And if you're a helper, then it all fits in there. So how I all got started with this is the state mandated individual career academic planning. Okay, and that is where we work with each student and develop their own plan for graduating high school. And in that plan, it includes, what are your talents? What are your academic talents? What do you love? What do you like to do? And there's interest inventories and goals and plans of study that go with that. But anyway, I got really interested in identifying students' talents. And so in surveys, I would send out through interest inventories and so forth. I'd call students in individually and just, what motivates them? What motivates you? And my biggest question is always, what do you do after school?
Right. Oh, absolutely.
It's not necessarily during school, but what do you do after school? And it's amazing what you can find out about a student. So anyway, I just gathered information about it. And at the same time, the state also mandated that when schools would go offer college classes or internships, we get points added on to our report card. Okay, so that became very important to the school. So part of my job in Bartlesville, they hired me as a college and career counselor. I started internships and just went out to the different businesses, and the hospital was the first one that I contacted. Yes, healthcare is very personal to me to begin with, but at the same time, everyone needs that. And so I went and talked to, actually there was a person there, Angie Beidelman, and she said it was okay if I mentioned her name. And she just happened to be in Bartlesville at the time. And she understood the need and how education and, students coming into the workplace or coming into the hospital, how important that was to help develop their talents. And so we had to work through a lot of hurdles. Okay, because hospitals, no, they would not allow a high school student to walk in the door.
We're incredibly regulated. Yeah, there's just a lot. Yes, I think those of us in healthcare, we appreciate it, and we also appreciate what folks appreciate what we have to deal with. Mm-hmm. So,
well, I totally understand. I mean, the HIPAA, and there was HIPAA and age, and Angie worked through it on her side of it, and on my side of it, I did the same thing. I had students sign confidentiality agreements, and then when they went to the hospital, they went through new employer training, and they learned what it was to function in a hospital. And so through all of that, I think the students have gained a real understanding of what it is. And James and I talked about this too. It's when they walk out of the high school and into the hospital, they change.
Sure. Well,
they're two different people.
They're young adults. They're professionals. I would assume, since they've gone through orientation, they know what's expected of them, as opposed to coming in and thinking, "Oh, this is a field trip." Right? No, they are now being assimilated into a team, I would think. James, what has been the experience when they come in to the hospital?
Yeah, it was just, and that was one of our big barriers, is just getting over those assumptions that high school students aren't mature enough to be in the hospital. They won't be able to maintain the privacy and deal with the maturity needed to take care of patients at the bedside. And so we had to work through that and ensure that through our pilot program, the initial 6 students that we brought in, that we monitored that and had conversations with them. And so we did. We put them through the full, not a full orientation, but a pretty in-depth orientation, and really hit on privacy and HIPAA and what they could and couldn't do as an intern. And they really shined. Those students came in, they did what was asked of them. They maintained all that confidentiality that was required. And they really got in and had conversations with patients and saw these would witness a patient death or a patient that was struggling with something, and they would sit down and have a conversation with patients and really support them through that. And so, identifying those students that Leslie can identify through ICAP and through that inventory assessment, and then she can bring those to us and say, "All right, I've got this pool of students, and they might be good for your internship," and then we can have a conversation with them, and we can show them and teach them what it's like to work in the hospital. And they've really responded amazingly to that, and I've done an amazing job.
There's a book called Bowling Alone. I don't know if either of you have read the book Bowling Alone, and it talks about, particularly for young people, what drives their willingness to invest their time. And so, hence, I'm older than you all are. And so, and maybe, Leslie, we know this from our parents too, where they were in bowling leagues, right? Bowling leagues were big. So you were a joiner, you did something. Nowadays, you don't bowl in leagues anymore. You bowl alone, right? So, how do you find that connection point for people that want to bring them into a larger unit or into a larger mission or into a larger effort? And they're looking for something for themselves. So I say that to know, do you find that the young people today are looking for that something that's outside of the potential for, income, but really it validates, their desire to do something that perhaps is a higher calling, or to be in service to their community and to their neighbors? And in your surveys and when you've worked with the kids, do you see that coming out of young people today?
I definitely see it. Okay. And that's part of what I'm looking for when I visit with them, is what's the underlying factor there that's motivating them. And in somebody who it's really in their heart to serve, they've been doing it their whole life. Okay. They
Sure.
may have been babysitting when they were in middle school. They might have been helping the neighbor next door when they were 5 and 6 years old. There are just different traits. And that's what I ask in my interviews, are those kinds of questions. And if maybe they were that student that was over there on the side putting all the little pieces of the puzzle together, well, that gives me another indication too. Okay, they like to put the pieces of the puzzle together. Are they people-oriented? And if they like to be around people, that again makes them very good for a healthcare field. So it's looking for that. And yes, I think our students are craving for that, especially in high school and especially their senior year, which is what has driven the internships so much, is the fact that they are, oh my gosh, what am I going to do now?
Sure.
Where am I going? How am I going to, what am I going to be?
Right. So you've had these kids come over, James. Have you hired any of them? Have you guys scholarshiped any of them to go into school with the expectation that they come back to the hospital? Tell us a little bit on what you've done on that side.
So we're 3 years in, and so our programs started pretty small, 6 students first semester. The pilot went really well. We had 6 students in the second semester, and so those first cohort and second cohort, and we started at one school. And so we're up to 10 schools and 48 students a year. And so
Wonderful.
we've expanded the program immensely. But that first cohort had a great experience with them. And I know that 2 of them are now finishing their second year at our local nursing program.
Okay.
And so we've developed a relationship with them. And really, this is all about relationships. It's developing a relationship with these high school students early, and them having a relationship with us. And so we're seeing them come back now as nurse externs. We have 2 employed. We had 2 that moved away to go to college. And so we have our local A&M college. NEO A&M College is a great school. We get 80% of our nurses from NEO A&M College. And they also have a PTA, physical therapy aid program, assistant program, and laboratory technicians. And so there's a lot that's not offered, out in healthcare professions outside of those in our area. And so our high school students have to move away. And so we're developing that relationship now with them. And so we have 2 students, one that went to UCO and one that's at Pittsburgh State in Kansas. And they are coming back for their summer externs.
So they can do that right there back in their community again.
Right. And so
Mom and Dad probably like that, so they're not sitting and playing Xbox all day.
yeah, they have a job when they
Yeah,
come. They have a
absolutely.
job when they come home for the summer.
Excellent.
They're employable. And so that's our goal, is to help these students find their transition, find their profession, find their passion, and then help them to be employable as they enter into the workforce.
Well, this is really good stuff, and we're going to continue this conversation when we come back from our break. We're talking here with James Sharp, who's the Director of Nursing for INTEGRIS Miami Hospital and INTEGRIS Grove, and Leslie Sexson, who's a Grove High School counselor. And we're talking about the unique partnership that they've created together in internships and externships through the hospital. And we'll pick up this conversation again after our break as we listen to a quick message from our friends at Forefront Healthcare.
Are you looking to elevate your facility's support services? Forefront Healthcare is a leading provider of food, environmental services, and facility management solutions to hospitals nationwide. Recently recognized in 2023 as a top 100 best places to work by Modern Healthcare magazine, our comprehensive boutique approach ensures measurable clinical outcomes tailored to your facility. Elevate your facility's patient, staff, and family experience today by visiting forefronthealthcare.com or call 800-684-6450.
And welcome back to our edition here of Inside the 1581. We're having a great conversation talking about how hospitals and healthcare organizations can partner with their local education systems to develop pipelines for young people to find opportunities working for hospitals and health systems. And I'm delighted to have in our conversation today James Sharp, who's the Director of Nursing at INTEGRIS Miami Hospital and INTEGRIS Grove, and Leslie Sexson, who is a high school counselor. I just promoted you there. I made you a hospital counselor. A high school counselor who has been instrumental in helping to create this program. And when we left at the break, we were talking about the types of students and what motivates students. And when we took our break, Leslie, you told me a story about a success story. Why don't you share with me about that? Because that had to be exciting to open the paper and learn about this. Tell us about a success story that you've experienced in this type of collaborative.
Well, I just last week I had the Grove Sun newspaper, and I was just about to move it or throw it away or something. Anyway, I opened it up, and on the front page was this big picture, and I kept staring at it, and I thought, I know that person. And then I looked at it, and it was like, oh my goodness, that was one of my hospital interns when we very first started the program back in Bartlesville. He was a Bartlesville High School student, and he went on to, he went to college, and then here he was working in our community, and he was serving as an intern for the Cherokee Nation. And it was just fabulous to see that. And I will throw another little story in there about him, about the high school.
Success stories is really important because as we might have school systems or healthcare systems looking at creating these types of partnerships, it is important that they learn and hear some of those success stories that can help motivate them to come together.
Well, this particular student was dead set on being a surgeon. And that's just what he said he was going to do. And we were like, okay. So when he went through his hospital rotations, which I have to give credit to the hospitals for figuring out that these students need to rotate to different departments. Well, I would always meet up with the students, like every week or every 2 weeks. And so I asked about, okay, how's the internship going? Well, he didn't like surgery. And I was like, but I thought you were going to be a surgeon. He said, well, I was, but when they come in, they're asleep. And when they go out, they're asleep, and I never get to talk to them. And he was very personable, and he loves working with people. And so he changed his direction to family practice because he knew how important that relationship was, and he wanted more of it than just that, in the surgical room. So
well, and that's really refreshing to hear. Because if you look at one of the core measures that we're measured on in healthcare is our patient-family engagement. So engaging with that patient, whether it's the physician or the other team members in the hospital, it's really important that we do a very good job on that. So to have a young person who is planning to be a physician, identifying themselves that, man, I want that type of engagement with our patients. We need more of that. Mm-hmm. So how refreshing it is to hear that. Mm-hmm. And so, James, when you're talking to these kids and you're working with them, what kind of feedback are you getting from them on a program like this?
At the end of every cohort, we do an exit interview. And so we bring all the students in, and we sit them down, and we just start asking them, all right, what was your best thing about the internship? What did you like the most? We just have them write it down on a sticky note, and they all put it on the board. And then we talk about it. We just have them elaborate about what they liked the most about the program. And then we have them do the same thing. What did you like least about the program? And the biggest aha moment for me is that it's always a relationship. They always talk about the relationship they have with the nurse, the physician that was very kind and caring to them and brought them in and taught and was teaching them while they were watching things. And then some of our biggest success stories are just what Leslie said. You have that student that said, I wanted to be an anesthesiologist whenever I came into this program. And now I know I definitely don't want to be an anesthesiologist. I want to be a nurse. And so, and we had the same thing the other way around. I had the opportunity to put my daughter through the internship last semester, which was amazing. And I got a ton of feedback from her. And she wants to do nursing. And she found out she wants to do anesthesia. She wants to be a CRNA. And so that's amazing. I was like, oh, I didn't know that you would want to do that. I felt like you would want to be more at the bedside as a bedside nurse or bedside caregiver. But she loved the surgery environment and loved what anesthesia was doing, putting people to sleep and waking them up again. And so those experiences are really our big wins, and that's the feedback we get from the students.
Did you find that the students were surprised at how many opportunities there are in the field?
Yeah, they only know about nursing, physician, and one other profession. And so usually they just have heard about something else. It's a lot of physical therapy, sports medicine is a really hot one, but they have no idea about respiratory therapy or radiology technician or laboratory technician. And so we give them the opportunity to be at the bedside. We do 1 to 4 week rotations in all of our departments. And it is all patient-focused care. And so we're trying to look at those clinical professions. And then we give them that opportunity to be at bedside, to be at the elbow with our laboratory technicians, our radiology technicians, in the ER, surgery, in our women's department. They all get to see birth, usually either C-section or live birth. And so that's always a great experience for them. And they just give us amazing feedback on those types of experiences.
So certainly they've had a very enriching experience in this. So what have you learned, the both of you? What have you learned through the development of this partnership, this collaborative, that you would share with others that should be part of their discernment as they're trying to decide, does my hospital want to host something like this, or does my school system want to partner with a hospital? What have you all learned?
Well, for me, all of our future workers are in the high school. And when we look at it from that perspective, and then look at it like, especially the senior year. Okay, the senior year, students, for the most part, have finished up most of the graduation requirements, and they're looking for an experience. They want to go out into the community, and they want to be a part of something. And the hospital was so open to working out all of the barriers that go with that that is what carried this partnership through. Plus, you guys being so people-oriented and understanding people and understanding where my students were at, I think that is what has made this work so well. And the fact that we keep communicating together, and I will follow up on my side, they follow up on their side, and if there's ever any issues going on, I may call and say, hey, there was a death in the family for this particular student. Please be understanding, and then vice versa. There would be something that may happen at the workplace, and they'll call me and say, hey, this happened today. Would you check and make sure that your student is all right? And so we just do that.
Yeah, it's the flexibility that it's been a good learning experience. Being flexible with student schedules and then working with the high school counselors, and just understanding that I would tell a hospital, if you're not engaging with a high school right now, and you have shortages in your workforce, and we all know that every hospital has shortages in their workforce, that you're missing a piece of recruitment. You're missing a piece of engagement with your community. I think all of our hospitals' missions are pretty similar. INTEGRIS is to partner with people to live healthier lives. And by engaging your high school students and building relationships early and keeping that intellectual capital in your community and bringing them back as healthcare professionals, then they have a real stake because this is their home, real stake in your community. Then you're doing that. You're partnering with your community and your patients that live in your community to be healthier and to be stronger. And so I would just encourage every hospital to get engaged with your local high schools and develop some kind of relationship there that will help bring those students back to your community whenever they have to leave to go to college and they need to come back.
And so would you say that, if you go back to business school, right, what's the return on investment? I mean, you have invested a lot, you've invested a lot, the school has. What would you say is the return? I would think the opportunity to keep our talent, in our community is huge, and particularly as healthcare, where we can document that we pay typically much better than the average wages in a community. So the opportunity for someone to have a good living in a community like Grove or in Miami, where they can own a home on a nurse's salary, as an example, I would think that would be a good community return on investment. What is INTEGRIS's community return on their investment for this?
It's just, like I said, I think it's just a part of our mission, and
Okay.
so that's the biggest return. That's the number one return. But then additionally, it's recruitment, and it's maintaining that talent that is leaving. And so, especially in Grove, we've gotten some of their top talent. I think all of our students were in the top 10% in our last cohort. And so, actually, the last year, our last two cohorts with the Grove High School, all of our students were in the top 10% of their class. And so, to be able to develop a relationship with the top 10% and understand that they have an interest in healthcare, and that maybe we can recruit them back into our community after they leave and go to get the education they need, I think that's a big win. And so it's a big win for the community, and it's a big win for the hospital.
What if somebody were thinking about starting this? What would you tell them if you gave them three directives or three suggestions on jumpstarting a similar type of partnership that you've developed? Each of you, what would be your counsel?
I would start with just developing the relationship with the high school. And so just reach out. I think I reached out to both of the vice principals at the high school,
Okay.
and then and also with the high school counselors, and just developing that relationship and saying, hey, we have an interest here, because it is a state mandate that they do career planning, and part of that is some on-the-job type training. And so to be able to offer that up as a hospital, and then to just find the people that are passionate in growing the children, growing the kids, the high school students. That's important. So
from your perspective, was it you that did the outreach, or were there other team members that did the outreach, or what would you expect the CEO to do that, or the CNO, or is it whoever is responsible for talent development? Should they be the ones reaching out? So what was the approach that you all used?
I think it can be at any level, and so finding the person that's willing to put in some time and effort, and that is passionate in education and building high school students is probably key. I had a passion for it. Leslie had a passion for it, and we were lucky enough to meet each other through the Healthcare Advisory Council. But then just finding those people that are passionate in that. There's every hospital's got educators. They have an entire education department. We all have robust education programs, and so you have them there. You just have to be able to leverage their talents. Sure. And then like as an administrator, hospital administrator, you can help bridge that if you need to. You have the contacts with your local high schools, especially in our rural communities. I mean, we're pretty tight, and so and we're a couple of the largest employers, and so we have a relationship already. And so, how can we leverage that to include this?
Leslie, what would you say to your colleagues or your fellow administrators if they're looking for a way to take and go the extra mile on doing this career planning for young people? What would you suggest to them?
It truly takes a dedicated person to do that. And the biggest factor that I've found is time. And I was so fortunate in 2 of the 3 schools. I was named as the college and career counselor. So that was my responsibility, was to develop career pathways and plans and so forth. And at Grove, I am a school counselor. We don't have anyone that's dedicated to that. And so my caseload, I'll be honest, is about 400. And so it involves a lot of other responsibilities. However, I'm still dedicated to this because it is the one life-changing thing for the majority of students that are able to participate in an internship. It gives them purpose. It gives them something to move forward to. And then the thing that James said, it's the relationships and the connections that they make. Yes, they might move off and they may go to another state for college. But guess what? They're still connected back here. And that's the main thing. And yes, we see them coming back. I've got students that actually are working in labs now, or they're a respiratory therapist or a speech therapist, or they are, just in some way they found their place in healthcare, and it was all through a hospital internship that started it. They just found different avenues, and they have come back here. And like I said, if they don't, but they've always got that connection, they've got that place they can go.
Sure, and I think that's really important. When we look at a state that for most of its history has been a rural state, the demographics are changing like they are in every state. Young people are leaving rural America and they're moving into the more metro communities. And so our state is at that cusp of evolution of moving from a rural majority population to a urban majority population. So small communities like y'all's, and we can list countless numbers of small towns across our state. Being able to keep their kids is really going to be important, not only from the standpoint of ensuring that the healthcare system's working, but we have a tax base that allows us to do everything else that we need to do in supporting our communities. And so I just want to say thank you to you guys for what you've done. We hope to be able to use this and this conversation to encourage other hospitals across the state to work collaboratively with their school systems to do just this. And so thank you guys for driving on down here to Oklahoma City to spend this morning with us on Inside the 1581.
Yeah, you're welcome. Thank you for having me.
Absolutely.
Thank you very much. We greatly appreciate it.
Well, we thank you. And this wraps up another edition of Inside the 1581. And we were joined today by James Sharp, who's the Director of Nursing at INTEGRIS Miami Hospital in INTEGRIS Grove, and Leslie Sexson, who is a Grove High School counselor, talking about their internship program and what they are doing in their partnership to ensure that the people in their community will have caregivers for generations to come. And as we wrap up, I want to say thank you to all of you who join us each drop of our Inside the 1581, and I hope you enjoyed today's episode. And again, as always, before we go, I want to extend a huge thank you to the folks at Forefront Healthcare for being our sponsor, and to our Director of Communications, Susie Wallace, who helps keep it all together. And she's shaking her head. No, I'm not. She's very humble, but she does a great job. And Alex Taylor, who's our producer of Inside the 1581. And again, as always, we also appreciate the soundtrack that we have from Gunslinger by Ends of the Earth, who provide the soundtrack for this and each and every one of our episodes of Inside the 1581. So until we come back together again in a couple weeks, we encourage you to visit us either on YouTube, Spotify, or on Apple Podcasts, or certainly on our YouTube channel. as we celebrate together the great work that's being done all across our state, inside our borders of the 1,581 miles of the state of Oklahoma. Thank you for joining us.